Well, measles cases are on the rise across the United States, with 20 cases identified in 11 states so far this year, including New York City. Natalie Kutchko joins us now with advice from one local medical expert who's suggesting caution over panic. Natalie.
Hi, Adam. Dr. Elizabeth Murray with WROC says while the pace of these cases so far this year is fairly increasing a bit quickly nationwide, it's not cause for a panic, recommending parents instead remain alert. Concerns rising over the highly contagious measles disease across the country. Common symptoms in children can include a rash, fever, cough, and congestion, a loss of interest in basic functions, and possibility of pneumonia and brain infection.
Well, I think it's important to remember a couple of things. One is in many communities throughout the United States, the rate of childhood vaccines went down during the pandemic. And in some areas, they continue to go down. There's a lot of different factors here, and you add maybe some decreases in some communities of vaccine rates, plus the incredibly contagious nature of measles. And, it's a recipe for a big mess.
Dr. Elizabeth Murray with WROC says while there's no sign of measles here at home, it's important to make sure your child's vaccines are up to date, with the MMR vaccine available at 1 year of age. Cases so far this year on track to outrun 2023's total of 58.
I have been a physician for 20 years now, and I have seen measles once, and that was back when I was in training. So there's lots of doctors and nurses out there who haven't necessarily seen measles either. And so the health department and others are working to make sure people understand the symptoms. Right now, I'm not aware that we've seen any in our community, and I think that parents need to be alert but not panicked. I don't want that message to get out there that we should be in a panic mode, because that is not the case.
The takeaway here, as mentioned, Dr. Murray says it's vital to make sure your kids are up to date on all vaccines. That includes the one for measles when eligible. And if there's any concern of symptoms, to first contact your child's primary care provider before making that visit to a doctor's office. Teresa, back to you.